My name is Jason Browder. I'm a physician assistant with Alpine Orthopedics in Gunnison, Colorado. We specialize in sports medicine and as well as general orthopedics. So I was just here to talk to you about ActivArmor, which is a device we've been happily prescribing for the past probably 8 to 10 months with really good results. It's a great alternative and really a replacement for traditional casts. We prescribe it to a multitude of patients ranging from very young pediatric patients to more elderly geriatric patients. For kids, it's amazing because they can get it wet, they can stay active, they can play in it, and it doesn't get matted down pretty gross like traditional casts do. You can swim in it, they can stay active and have fun in this cast, where traditional cast is much more restrictive as far as what activities you can do, which makes it great for the athletes we see. Athletes, after being in this cast, they can go back to mountain biking, skiing, they can cross-train without the negative impacts of a traditional cast as far as holding them back from those activities. As far as our geriatric patients, they love it because it's custom fit. So it fits perfect, and it's great for them where they're more apt to skin breakdown. These casts are really comfortable to be worn because they're custom 3D printed, so it's the perfect fit. So you don't get that skin breakdown and wear and tear like you do with a traditional cast. As far as the conditions we prescribe it for, it's a multitude of things, from acute fractures as well as post-op patients. We used it a lot actually post-operatively directly after closed reduction with internal pinning and even ORIFs. We'll do a scan directly after surgery and then place the cast on directly when we get it. Patients love that because it's much more breathable, less risk of infection as well. We've actually had a couple casts where we'll leave a cutout where the incision goes so we can view the incision as well as the pin sites and make sure they're looking good. Where a traditional cast, you can't really monitor those, so you have to use more of a clinical judgment as far as how that side is looking and the risk of infection. So these are great for post-op patients as well. As far as chronic issues, we've used it a few times, and a decent amount of times actually, for tendon issues like intersection syndrome. We've also used it for other symptoms like carpal tunnel. It's a great immobilizer that's very comfortable, and it's small and lighter than a traditional cast, so patients can stay active with it. As far as the benefits of the traditional cast, there's a multitude. The biggest one for me is probably the breathability and the comfort of this cast. You can see obviously the air holes for this, so they don't get wet and sweaty like a traditional cast does after several days. With these casts, you can stay active as well. Like I've said, many patients go back to skiing and mountain biking right away, basically, and they can go swimming, they can cross-train, they can do everything in this cast, where a traditional cast, it's pretty hard to go swimming unless you get a bag around it, but it's going to get wet no matter what. It's hard to shower in a traditional cast, obviously. These are great for just staying clean and staying active. Patients love it because it's fit perfectly too. Traditional casts, with the padding, they usually get worn out after several days. You get irritable with some of the spots that they rub on. So with these, it's the same fit the entire time, so patients really enjoy that. The outcomes we've seen have been really good with these. It provides a great stabilizing mechanism because, like I had mentioned just briefly, I had briefly mentioned before this was the fact that traditional cast is always going to get loose with time because the padding is going to get worn down and the fiberglass is going to stay at the same diameter, basically. With these, it's the same fit, so it's never going to change. With a traditional cast, it's going to get worn out and it's going to get loose. So we've seen same healing rates, I would say slightly better because it's the great fit and it's a great immobilizer. Same with some of the more chronic issues like intersection syndrome. It's a better fit and a better support than a traditional immobilizing device. The other great thing about it as well is traditionally, if you have a fracture and injury, you're going to go from a cast into a splint, and you're going to need two different devices. With these guys, you can use it as a cast, and then you can use it as a splint as well because it's so easy to take on and off. You can lock it in place when you need it as a cast, and when you need it as a splint, you can use the twist ties that allow it to come off, on and off very easily. Also, a lot of times with fractures, you need multiple x-rays out of plaster. So with a traditional cast, you may have to do 2 or 3 cast changes while you're getting those x-rays, which obviously costs money. With these guys, you just take it off, take the X-ray, and put it right back on. So there's no issue with that. As far as clinic benefits, it's huge. One thing, it's increased patient visits, really, because when a kid is walking around with this cast, all his buddies are pretty excited about it, and if they unfortunately have injuries, they want to come here and get that same cast, because they can see how active they can stay in these ActivArmor casts. The other thing is there's no inventory, really. All we have is the scanning device. We take the scan, send it off, and it comes in within several days, so we don't have all the casting supplies you typically need. So that's a huge cost saver, and it's a big cost saver to the patients, because they don't need multiple fiberglass casts. They don't need multiple slits. They just need one device, and that's all they need. And as far as feedback from patients, I haven't had a patient with a negative feedback yet. They love it. The custom fit's amazing. The fact that it's breathable, you can stay active, and you can get it wet is the huge benefit for patients, and they just love it. So we've been super happy with it, as well as our patients. So I would highly recommend this device to anybody that really needs a traditional device or any immobilization device. Even a splint, this works great as a splint and works great as a cast. So it's been a real game changer for our patients and our clinic in general. So I highly recommend it. And yeah, thanks for taking the time to listen to this.